Hi, my name is Rubina, and today I will be discussing decreased milk supply and the hypoglycemic newborn for my BCIT breastfeeding theory course. In this presentation, I will include what hypoglycemia in the newborn is, factors causing decreased breast milk, 3 priorities found after assessing the case, and lastly, possible treatment options in this situation. I will be applying the situated clinical decision-making framework to explain this case. This framework consists of 5 components, including knowledge, cues, judgment, decisions, and evaluation of outcomes. What is meant by newborn hypoglycemia? Newborn hypoglycemia is a reading of less than 1.65 millimoles per liter in the first 24 hours after birth, and less than 2.5 millimoles per liter thereafter. Hypoglycemia is an inadequate amount of glucose for sufficient neurological development. Severe cases can lead to mental retardation, seizures, personality disorders, and delay in the overall development. During pregnancy, the fetus receives their glucose supply by the mother through the placenta. At birth, the umbilical cord is clamped, leaving the newborn to live off of their own glycogen stores, which accumulate primarily in the 3rd trimester. Hereafter, it becomes vital to breastfeed to provide a newborn with sufficient glucose. With insufficient breast milk, this becomes difficult. This picture portrays a newborn's glucose supply, as discussed in the previous slide. The top is a newborn in the intrapartum period, whereas below shows the postpartum. Hypoglycemia in the newborn can be caused by 2 factors, either the overuse of glycogen stores or inadequate production of glucose. Stores can be overused in circumstances such as when there is an excess insulin, cold stress, or problems with metabolism. Reasons for inadequate production of glucose can include non-functional brain glucose transporters and suppression of gluconeogenesis. Newborn risk factors for hypoglycemia include newborns that are either large or small for their gestational age, have experienced cold stress, respiratory distress, are premature, suffer from an illness such as jaundice, have an infection or abnormalities in their endocrine system, and also have had a delay in their first feeding after birth. Maternal risk factors include diabetes or gestational diabetes, as insulin from the mother can deplete glucose supplies in the newborn. Hypertension, smoking, as well as weight gain or other risk factors. There are also intrapartum factors that play a role in newborn hypoglycemia. The length of labor, anesthesia, lack of oral intake by the mother, fetal distress, medication use such as tocolytics, and cold stress are such factors. Hypoglycemia can be seen in the infant as the following: jitteriness or tremors, lethargy, seizures, cyanosis, which can be described as a bluish discoloration of the skin, tachypnea, apnea, diaphoresis, poor suckling, pallor, irritability, hypothermia. In some cases, the infant may not show these signs and can be asymptomatic. There are many reasons why a mother may have an insufficient milk supply. Some of these reasons include a delayed first feed, not feeding the infant often enough, which often occurs at night. There is an ineffective latch, which may be caused by several factors such as a tongue tie or inverted nipples, supplementation such as that with formula, and the use of medications as well as herbs, including parsley and peppermint. Separation of the mother and newborn can also lead to a decreased milk supply. There is a decreased stimulation if the dyad is rooming separately. Use of accessories such as a pacifier should also be avoided. Other factors that may decrease a mother's milk supply may be related to insufficient glandular tissue, possibly related to a surgery such as breast reduction, hormonal and endocrine problems including hypothyroidism, hypertension, and diabetes, and lastly, dehydration. There are cues that show whether the mother has an insufficient production of milk. Ask yourself the following questions. Is there audible swallowing by the newborn? Does the baby look satisfied and content with the feed? Is the mother able to hand express or pump adequate amount of milk? Hypoglycemia and decreased milk are in fact correlated. If a mother is not producing enough milk, the baby will not get sufficient glucose from feeds, leading to hypoglycemia. In turn, a baby with hypoglycemia may have trouble in feeding and suckling, decreasing the stimulation of the production of milk. This situation can have a great effect on the feeding relationship. It can be It can be a frustrating experience for the mother to try to help the baby with hypoglycemia, but not having enough milk supply to do so. As nurses, we can refer a mother to several consulting services. She can be referred to a lactation consultant, can be educated about breast milk donation services, or can be referred to a public health nurse, which may have access to a breastfeeding clinic. The 3 priorities I have come up with in the situation of insufficient breast milk with the hypoglycemic newborn are: 1. To assess the cause of hypoglycemia and insufficient milk supply. 2. To monitor and regulate the newborn's glucose levels. And 3. To support and educate the mother and family. To assess the cause of hypoglycemia and insufficient milk supply, we need to figure out if a maternal or neonatal factor is responsible, or if a combination of factors play a role. Finding the root cause of the problem is mandatory before resolving the issue. Monitoring the newborn's glucose levels is vital. Regular glucose checks need to be done. One glucose check 2 hours after birth, and then a check before each feed until there are 3 normal glucose readings. It is also important to assess for signs and symptoms of hypoglycemia and also to check the infant's development through ways such as checking newborn reflexes. Weight gain is a determinant of infant development. A newborn should gain about an ounce a day, but remember, it is normal for a newborn to lose up to 10% of their birth weight in the first couple of days. They should begin to gain weight after about a week. Continue to assess the baby's input and output. This ensures that the newborn is getting enough nutrients for their developmental needs. A baby should be feeding every 2 to 3 hours, or equivalent to 8 to 12 feeds a day, and should have about 6 to 10 wet diapers or a wet diaper after most feeds. Assess the newborn's stool. It should change from a dark meconium to a yellow color by day 5. One of the most important priorities, but one that is often forgotten, is to support and educate. This situation can become a frustration for any mother and family. Educate the mother about the signs and symptoms of hypoglycemia and about the reasons why her milk supply may be low. Encourage the mother. Show the mother that the problem can be managed. Breastfeeding is a special and intimate relationship between the baby and the mother. Do not forget this. Treatment options for this case will be unique to each dyad and depend on the cause of hypoglycemia and insufficient milk supply. Encouraging breastfeeding is vital in each dyad. Remember the 3 E's, early and often. Start by having the baby skin to skin. This will allow stimulation of the breast and release of more oxytocin. Make sure you are feeding on infant cues and not on a schedule. Effectiveness. There needs to be an effective latch. The baby needs to be covering majority of the areola and not just the nipple alone. There should also be audible swallowing. Lastly, maintaining exclusive breastfeeding. It is not a good idea to supplement with formula or other means unless there is a contradiction to breastfeeding. Milk supply is dependent on supply and demand. By following the 3 E's, the baby will increase the demand by breastfeeding more frequently and effectively. If breastfeeding alone does not help the newborn's glucose level, IV glucose may be needed. This is often a 5 to 10% dextrose strip. If IV glucose is ineffective, surgery may be considered. Surgery is used as a treatment option if the newborn has a hyperactive insulin production. This would mean that any supply of glucose would be depleted because of the insulin. This surgery involves an 85 to 90% resection of the pancreas. Developing diabetes is one risk associated with this procedure. Education is important on top of any treatment. The mother should be educated on the signs and symptoms of hypoglycemia, about the significance of breastfeeding and the 3 E's, and about consultation and support services in the community. Evaluation of outcomes. To evaluate the effectiveness of treatment, we need to check the newborn's glucose level by checking the blood glucose, assessing for signs and symptoms of hypoglycemia, and monitoring intake and output. Checking the effectiveness and frequency of breastfeeding is essential. Ask the mother if she has enough information about hypoglycemia and decreased milk supply. Is she aware of the 3 E's? Most importantly, ask the mother if she feels supported. For successful treatment, both mother and fetus should not look or feel distressed. In conclusion, decreased milk supply and hypoglycemia in a newborn are interrelated. This issue can be extremely frustrating for a mother and family. As nurses, it is important to assess the cause of the issue, monitor and regulate the newborn's glucose levels, and support and educate the mother and family. I hope you enjoyed this presentation. Thank you.